So good morning, everyone. I'm so glad you, I don't know if you had to sign up for this, but you're here to listen and learn. And I want to really thank all of our friends at Good Samaritan Hospital, Catholic Health, for doing this, going to our various senior centers. Medication management is the name of the little workshop you're going to be partaking in today. But it is so important, you know, as people get older, we get older, taking more meds, no good, I'm very lucky, I just take vitamins, but a lot of us have to take medications. And sometimes I find doctors prescribe and don't always look at what you're already taking, and I think you're going to learn a lot today. So without further ado, and again, thanking Good Samaritan and everyone involved there, and also our team here at the center, Cheryl, Carol, Patty, all of you that do so much to bring these programs to us and provide this safe haven for you to come to every day. I would like to introduce the pharmacist, Bahati. Your first name is?
Shujat.
Shujat. So he is going to share some really important information with you. So enjoy, take care, and I have a feeling there's going to be some snacks after, right?
Yes.
Okay.
All right, so good afternoon, everyone. Well, actually, good morning still. I'm Shujat Bahati. Thank you for that introduction, Angie. I appreciate that. Thank you for having me here today. The name of the presentation is Medication Management. I believe everyone has the document in front of them. Okay, so there's a few different things we're going to be going through today. You know, medication is something that's very specific, right? There's so many medications out there, and there's so many different medical conditions patients might have. So it's very hard to do a presentation that's really tailored to each patient here, or each adult. So I'll go over a little bit of a brief overview of what are some things that I see over in Good Samaritan Hospital, what are some of the issues, and what are some of the very important tips that every patient should have. So we'll go over a few very important different topics. My background is that I've been at Good Samaritan Hospital for about 7 years now. So I've been there for a long time. Before that, I was working in Brooklyn, so I've been a pharmacist for about 9 years now. Other than working in Good Samaritan, I also do moonlight at CVS Pharmacy as well. So I kind of get to see pharmacy from two different perspectives. I get to see it from the hospital side, and then I also get to see it from the community side as well. So I'll share some of my experiences with you today. So going into the presentation, the first thing I always like to talk about is having a medication list. So you'll see on the second slide is that I recommend every single patient who is taking medications to have a medication list that they carry with them. All right, so there's a few different reasons why we find it so important. And in that medication list, it shouldn't just be the prescriptions that you're on. There should also be non-prescription medications on there as well. And we'll go into that a little bit more later on in the presentation. So maintaining a medication list is very important because it keeps your doctors up to date with the medications that you're taking. Like Angie mentioned, you might be going to different doctors. They might not know what another doctor has done for you. Most of the patients nowadays are seeing at least 2 different doctors, if not more, right? There might be a heart doctor that you're seeing, a lung doctor, a kidney doctor, a primary care doctor. So one doctor might not know what another doctor is doing. So we are in an era where everything's electronic now, right? There's no more papers, everything's in a computer. But I will say, still, a lot of the computer systems don't talk to each other. So when I see patients in the hospital and they see doctors outside the hospital, I sometimes don't have those records. So we're relying on a patient list from the patient themselves to go over what medications they're taking. So it's very, very important. What sometimes happens is, let's say you see a heart doctor, they add on 2 new medications for your heart. Now you go to your primary care doctor, and let's say your blood pressure is high. Right? They might not know you just started a blood pressure medicine a few days ago from the heart doctor, and they might add on a medicine that's kind of duplicating what you already were started on recently. So that's why having that list, providing it to the doctor at every single visit, is very important so that they're aware of what are some of the changes that have been going on. So I know it becomes a little tedious. Sometimes, you make a nice brand new list, next day you go to the doctor and now you have to change something, right? So it becomes a lot of work, but in the end, taking the extra step and making a list can save you a lot of different issues down the road. From the hospital perspective, why it's so important is that usually, hopefully, a lot of you don't have experiences where you have an emergency and you urgently need to go to the hospital. But when you have that situation, you can't sit down and make a list before you go to the hospital, right? You need to urgently get there, the ambulance is coming. The first thing the ambulance will ask is, do you have a medication list, right? Now, if you don't have one at that time, you're obviously not going to make one at that point, and you're going to the hospital. Now, you come into the hospital, and if we can't get in contact with your loved ones, right, we won't know what you were taking at home, right? So now, that's very, bad. Why? Because one of the reasons why you might even need to come to the hospital is maybe because something went wrong with your medications. Right? That's one part of it. So we need to know what happened, because medications, like we know, they help you, right? But they can also cause side effects. They can also cause problems. The other thing becomes, I see a lot of patients with conditions such as heart failure, right? So heart failure is a medical condition where your medications always need to be adjusted to help you live a healthier and better life. So when you come into the hospital and I don't have a list, we will assume you're not taking anything, right? And then we'll have to add on a lot of new medications. And, that's not the right way to do things, because if you already are taking some medications, we like to know what you're on so that we know those things obviously are not working, right? So you have to know what a patient is taking. That's why it's very, very important that you have that list. The other reason, you have some examples in the slide here, is in terms of side effects, drug interactions, drug duplications. If any one of you gave me your medication list right now, I can easily tell you if there's any interactions in there as a pharmacist. I can tell you if there's any duplications, any interactions, or any drug that can possibly cause side effects that you're feeling. But again, if you don't have that list, I wouldn't be able to tell you that. So that's one of the main reasons why it's so important that you have a medication list. Maintain that all times, and always carry that on you in person. The next slide here, we talk about medication storage. All right, so there's a lot of misconceptions when it comes to medication storage. One of the biggest ones is that, we call medication cabinets to the cabinets in the bathroom, right? In general, you should not be keeping medications in the bathroom, right? Does anybody know the reason why? Heat, exactly, right? A lot of people take hot showers. You see how that room gets after a shower, right? A lot of humidity, a lot of heat, that can make a lot of pills go bad, all right? Even though you physically might not be able to see them going bad, but a lot of medications are powdery, and when they touch humidity, they become powdery, and the medication loses its potency. So even though it might look like it's a normal tablet, the medication has actually lost its potency, and that's not good. So really, I recommend never keeping medications in the bathroom. The general rule for all medications is keeping them in a cool, dry place away from sunlight. All right, so always keep medications out of direct sunlight. That's why you notice a lot of the pill bottles that you have at home, they're like an amber color, orange color vial, right? The reason why medication vials are that color is to protect them from sunlight, because sunlight degrades medications as well. So general rule, not in the bathroom medication cabinets, cool, dry place away from sunlight. The other area that I say to avoid, two other areas that are very important to mention is, do not leave medications in the car for too long. All right, if you're traveling, you of course keep a little pouch or bag, something with you to carry the medications around, but don't leave them out in the open in a car. And if you are going to, bring them with you, do not leave them in the car for too long. Again, same reason, right? There's a lot of sunlight. You can see the cars, the sunlight directly hitting the cars, and a lot of heat, especially in the summertime. A car can go up to 100 degrees inside, right, in the summertime. So you have to be very, very careful for that. The other thing is leaving them near your oven. Same concept, right? In the kitchen you can leave them, but not near the oven, because again, a lot of heat around that area, so you want to avoid medications, being in that type of area. Now, there are some exceptions to this, right? Drugs that require refrigeration, right? There's medications such as insulin. I'm not sure if anybody here is on insulin, but insulin needs to be kept in the fridge until you start using it. So, for example, let's say you have insulin pens in the fridge. Pens that you're not using for insulin or vials should remain in the fridge, but when you start using them, you do not have to put them back in the fridge. All right, so that's another misconception patients have. Insulin unused, keep in the fridge. If you started using them, you can keep them at room temperature. Now, the question becomes, how long is insulin good for, right, at room temperature? The general rule is 4 weeks. Insulin is good for 4 weeks at room temperature. All right. Most of the times, insulin is not even. One pen is not even enough for 4 weeks, right? So you're running out of it before that period even happens. So that's another very important thing to keep in mind. There are some insulins that are good up to 8 weeks. So is minimum all pens, all insulins are good for 4 weeks, but some of them might be stable for longer. Now that becomes very important. Let's say you're traveling somewhere, right? You're not going to carry an ice pack or a miniature, fridge with you, so you could keep insulin with you for 4 weeks without needing refrigeration. So that's a very important concept that I like to, give out to patients. Very, very important to keep that in mind. So, a lot of some of the things that I'm talking about today might apply, right? Because not everybody here might be on insulin. If you have any questions, you can raise your hand throughout the presentation. If you want to ask me something more personal, at the end of the presentation, you can come up and I'll be more than happy to answer your questions. My business cards are also out there. You can call me in a hospital at any time, even after the presentation, if you want to discuss something. So then the next topic I want to talk about is taking medications. So that's the next page on the slides here. So taking medication, again, it's very specific, right? There's hundreds and thousands of medications out there, right? Each one should, might have different, directions to take it. I like what most pharmacies are doing now. If you use CVS Pharmacy, I've noticed that if you look at the bottles, it says it on there what time of the day to take it or what time it's recommended. So it usually says morning, afternoon, evening, bedtime. So that kind of helps you know how to take the medication, what time to take it. The other big question becomes, a lot of patients ask me, let's say I recommend someone a new blood pressure medicine they started, they say, so should I take this with or without food? That's a very big question. In general, unless your bottle says it or the paper that comes with the prescription says it, you can take medications with or without food, but there are some exceptions to that, which I'll talk about in the next slide. So bottles usually now say the time of the day, with or without food, and most medications either way is fine. But the exception to that is sometimes you might take a new medicine and your stomach starts hurting, right? Or sometimes you're taking a lot of medicine, right? Let's say you're taking like 6 medicines in the morning. Taking them all at the same time might hurt your stomach as well, right? So in that case, we usually say medications, if you're taking a lot of them and you feel like it's hurting your stomach, always just eat something and then take the medication after that. You're not going to lose the potency of the medicine, except for a few exceptions, which I'll talk about in the next slides. So there are also some exceptions to this of medication that can be taken with certain foods. So I'm not sure if anybody might have heard, sometimes the pharmacist or the pharmacy might tell you, do not take this medication with dairy products. Has anybody heard that in the pharmacy? All right, so a few of you have, but most people have not. Again, you might not have been on that type of medicine, right? But in this slide, I have a few names. So you'll see in the slides, you can obviously take this at home and match it up with some medication that you might be taking, if you can't remember the names right now. But there's certain medicines, I'll give you some examples: tetracycline, minocycline, doxycycline, levofloxacin. These are all antibiotics again. So these aren't medications that you regularly will be taking anyways. But there are many antibiotics that you should not be taking with dairy products. So it's always good to know when it comes to antibiotics, always ask the pharmacist, right, when you're picking it up, or you can call them and say, I'm on this new antibiotic, should I take it with or without food? And they'll tell you if there's any restrictions. Another example is the medicine for osteoporosis called alendronate or ibandronate. So these are medicines for osteoporosis. You should not take it with dairy products. Actually, the recommendation is you take it first thing in the morning on an empty stomach with just water. No food for at least an hour. So that's an example. The next one is called levothyroxine, which is Synthroid. Another very common medication. My mom takes this medication as well. So thyroid supplements, right? Levothyroxine, Synthroid. If you don't already know, it's very important to take it on an empty stomach first thing in the morning. Right? At least 1 hour before food and before medications. Right? Now, if you don't do that, what happens is the food and the medicine actually bind to each other and you don't get the full absorption of the drug. So what happens, a lot of times patients come into the hospital and their thyroid function is, abnormal. And then we'll say, are you taking the medicine? They're like, yeah, well, I take it every single day. But the thing is, they're not taking it always on an empty stomach, and that affects the way the drug works. And what are we going to say? We're going to increase the dose? When really, you don't really need an increase of a dose. You just need to take it the way it's recommended. So that's why it's very important when it comes to those drugs. You'll see the next slide here, I have some examples. So, sometimes we say, take medications with food for a few different reasons, right? So I'll give you some examples. There's certain medications that you should take with food to reduce the side effects. What are some of the side effects? Like stomach upset, right? So one example is NSAIDs. NSAIDs are over-the-counter prescription medicine for, arthritis, for inflammation, for any type of pain. I'm sure you've heard of some of these names. Advil, Aleve, Motrin, ibuprofen, naproxen. These are NSAIDs, right? People take them over the counter quite frequently as well. These medicines should always be taken with food, because if you don't, there's a chance of you getting heartburn and even ulcers as well if you do that for a long period of time. So it's very important that you take that with food. Also, drugs like steroids. Steroids aren't something people take long term, but if you have lung conditions and you have trouble breathing or asthma, sometimes your doctor might put you on something called prednisone, or metoprednisolone, or the Medro packs. You've probably seen those packs where you take 6 the first day, then 5, 4, 3, 2, 1. Those, it says it on the package, but you should always be taking that with food as well, again to reduce any stomach upset that can possibly happen. And then we go into another category of medicine that should be taken with food. Now these are diabetes medicines, right? Because if you don't take it with food, what's going to happen? Your sugar is going to tank. And that's very, very dangerous, especially in the elderly population, because having low sugar can make you pass out, right? Can make you fall, can make you hurt yourself. We get patients in the hospital, all the time that come because they fell down. Why did they fall down? Because their sugar was too low, right? So certain medicines I have listed out here, glyburide, glimepiride, glipizide, repaglinide. I just put the names out. I don't expect you to remember the names, obviously, but I just put it out there that if anybody is taking these medicines, to make sure that you're taking it with food. These medicines should be taken with food because you don't want your blood sugar to go too low. The next column you see here is take medication with food for medication to be effective. So remember how we were talking about medicines that should be taken on an empty stomach, like the thyroid medicines? Now there's certain medicine, not a lot out there, but there's a few medicines that should 100% be taken with food, because if you don't, the medicine doesn't work. Right? So what are some examples? One example is Xarelto. Anybody heard of that drug, Xarelto? Yeah, so it's a pretty popular medicine. It's a blood thinner, right? So you might use it for either a blood clot or any heart condition. So Xarelto is a blood thinner. There's a lot of blood thinners out there, right? Pradaxa, Eliquis. Xarelto is one of the blood thinners that you have to take with a full stomach, right? So why? Because if you don't take it with a full stomach, you only absorb 60% of the medication. Right? That's almost half of the medication. So if you are on that medicine, make sure you are taking it with food. Again, when it comes to a blood thinner, imagine getting half of the dose and not the full. Right? You could end up in the hospital with a blood clot or a stroke. So very important when it comes to the Xarelto, make sure you take it with food. Some of the examples are patients who might have kidney disease are on these drugs. They're called calcium acetate. Again, this is not the calcium that's over-the-counter vitamin. This is calcium acetate. It's for your kidneys. So if someone is on that, you have to make sure you take that with food. Another drug is called Avail. That you should be making sure you take it with food. Again, if you do take these medicines at home, make sure you are taking it with food. And now the last column I have here as an example is take on empty stomach for better absorption. We already mentioned some, examples like the thyroid medicines, right? The bone medicine, alendronate. But also a medicine for heartburn and ulcers. And these are very common medicines you might have heard, like Prilosec, omeprazole, right, Nexium, Dexilant, right, pantoprazole, Protonix. These are medicines for your stomach, right? The doctors might prescribe it to you because either you have gastritis or, ulcers or, food tube issues. You should always be taking those medications on an empty stomach because it makes the drug work better, all right? So always keep that in mind as well. So that's some examples. And again, if you have questions afterwards and you're not sure how to take your medicines, the best thing to do is just call your pharmacy, When I work at CVS and I get calls from patients, I like taking those calls because it tells me that the patient is, the inquisitive, right? They want to know about the medicine, they're concerned. So always feel free to reach out to your pharmacist. If you're not picking up your medicines yourself, let's say you get delivery, you can still, there's always a phone number on your medication bottle. You can always call the pharmacy, and 24 hours of a day, you will get a pharmacist at those lines that can help you understand your medications in terms of how to take it, any side effects, any drug interactions, things like that. So talking about drug interactions, it takes us to the next topic, right? So drug interactions is another very important thing a lot of people and patients in general have to be aware of, right? So when I say drug interactions, right, I don't expect anybody to know about drug interactions themselves. But the reason why I bring this topic up is to make a certain point to you. So drug interactions, right? Drug interactions means a drug is interacting with another drug of yours, right? That's one example. But keep in mind, drugs can also interact with food, right? Like we mentioned. Drugs can also interact with vitamins. Drugs can also interact with your, your vitamins, your minerals. Also, at the same time, drugs can interact with your medical condition, right? So this is another reason why it's so important, especially when you're seeing a new doctor, to bring a medication list, because if you have diabetes, right, there's certain medicines you should not be taking. If you have heart failure, there are certain medications you should not be taking. If you have COPD, there's certain medications you should not be taking. Again, depending on your conditions, there's a set of medications you should not be taking. Again, we don't expect you to know these medicines, but that's why the list is important. So your doctor, if you see them for the first time, they can look at what conditions you have and say, oh, this medicine, we're going to stop it for this reason. Again, another thing is, let's say, some people say, well, I've been taking this medicine for 20 years, right? I never had an issue. But keep in mind, as we age, right, new medical conditions come on, right? You might not have had certain conditions, right? A lot of patients who develop heart failure don't develop it when they're young. They develop it when they're older. Same thing with COPD, right? COPD is a lung condition, most commonly due to years of smoking, right? Patients don't usually, no matter how much you smoke, you're not going to develop COPD when you're 30s, 40s, and 50s. Usually after 50s is when it comes on. And now if you get diagnosed with those conditions, your doctor might take you off of medicine you've been on for a very long time, is because that problem wasn't there when you started that medicine, but there is now. So that's very important when it comes to drug interactions. Now, one of the main points I want to make is, whenever you pick up a prescription from a pharmacy or whenever you get it delivered to your house, right, the main duty of that pharmacist working is to make sure your drugs don't interact with each other. Right? So that's why I say you're not responsible for drug interactions. The pharmacist who's going to be giving the drug is responsible for looking at your chart. Okay, so Mrs. Smith takes A, B, C, D, E drug, and now the doctor prescribed this new drug. So they'll look for interactions. If there's an interaction, they will not give you that medicine. They're going to tell you about it, they'll call your doctor, they'll get it changed. So sometimes when you go to the pharmacy and your medicine isn't ready, and the pharmacist says, oh, we're reaching out to your doctor, right? That's usually the reason why. There's usually an interaction with your medications. So why do I bring this point out to you? What if you use 3 different pharmacies, right? What if you use 2 different pharmacies? The pharmacist will not have records of what you're taking from a different pharmacy. That's why we always recommend you should really be only using one pharmacy. Right? The exception to that is if you use a mail order pharmacy, right? Nowadays insurances make you use mail order. I'm not sure if anybody has experienced that, but we're going into an era where your insurance might say you have to get your prescriptions mailed to you, you cannot use a local pharmacy. Right? And that exception is fine. You can use a mail order for your long-term medicines, but if you need an antibiotic, you're not going to have your mail order company mail that to you, right? It can take 2, 3, 4, 5 days, and then you go to your local pharmacy. So in that exception, it's okay to use 2 different pharmacies because you're using one for long-term and one for your antibiotics. But in general, if you're using a local pharmacy, do not use multiple pharmacies. And if you are using multiple pharmacies because of any reason, let your pharmacies know what your other medications are that you're not getting from them. Because if my computer screen, if you don't get a medicine from me at CVS, I won't know. If you use a mom and pop pharmacy or Walgreens, I won't have those records, and I can't fully find interactions if I don't know what you take, right? So that's why it's very important that you use, one pharmacy. The other thing is, what if you take vitamins and minerals, right? So vitamins can interact with medicines. Herbal supplements, which we'll talk about in the next slide as well. Herbal supplements, again, a lot of them, people swear by, and it does help people, right? But there's a lot of herbal medicine out there that causes major interactions. So I always say, if you're going to be going to the pharmacy to buy some herbs because somebody recommended it to you, right, always check with the pharmacist before. Always let them know what medication they're already on, because it might be completely safe or it might be completely unsafe, right? And you won't know until you actually bring it up to the pharmacist. So that's why the medication list that you make, remember how I mentioned, it should have non-prescription medications on there. That's why when you make that list, not only your prescription, but your herbs, vitamins, everything should be listed on there as well. And again, if you're not in the pharmacy, let's say you ordered a vitamin or herb from Amazon or something, you can still call your pharmacy and ask them if there's an interaction or not. So always keep that in mind. I have a nice picture here that you see in one of your slides. That actually goes back to that. See how drug can interact with drugs, drug can interact with food, drug can interact with supplement, and then drug can interact with medical conditions. So I just like to put that out there so you're kind of aware that when we say drug interactions, we're not just talking about one drug interacting with another drug. So usually what happens when drugs interact, right? So people say, all right, well, what happens when drugs interact with each other, right? So there's a few different things that can happen. One drug can make another drug work less, right? So it might reduce the effectiveness of one drug. Sometimes one drug causes the other drug to work too much. So that can be dangerous, right? Like for example, one blood pressure medicine can make another blood pressure medicine double its effect. And what happens is now your blood pressure might become too low. So that's another example. Or what can also happen is one drug interacts with another drug, and now with both of them being together, they increase your risk of having certain side effects. And we'll talk about that too in that chart that you'll see below. So we have some examples here. Again, I have a bunch of drugs listed out here. It's just for your own reference. But I want to just give you some examples of drug interactions, right, of why we get certain issues. So one topic we'll start off with is, it says on the top, if you take anticoagulation or antiplatelets, right? So anticoagulation, antiplatelets are blood thinners, right? We just call them blood thinners, but the real, medical term is anticoagulation, antiplatelet. You might be taking this medicine for blood clots, for heart conditions. If you ever had a heart attack, you might be on these medicines, So examples are Coumadin, which is warfarin, Plavix, Eliquis, Xarelto, Perdaxa, Brilinta, Effient, right, and aspirin, right? Aspirin is technically also a blood thinner. The reason why I like to say out these names is because when you sometimes say these names, then it kind of rings about, oh, I actually do take that at home, right? So that's why I like to, actually say the names of the drugs on the list. So if you take these blood thinners, there's a few drugs that you should avoid, and that is NSAIDs, right? So your doctor might have already told you, or the pharmacist, or maybe you haven't heard of this before, but if you take blood thinners in general, you should avoid NSAIDs, right? NSAIDs are Advil, Aleve, Motrin, ibuprofen, naproxen, right? Unless your doctor prescribes it to you, him or herself, do not take NSAIDs over the counter if you are on blood thinners, right? NSAIDs are very good drugs in terms of treating arthritis, right? Treating pain, treating headaches, treating migraines, and they're very available, right? You can go out right now, buy 100 bottles if you wanted to. But keep in mind, they can cause interaction. They can interact with your blood thinners. And what happens when you take NSAIDs while you're on blood thinners? The reason here is listed, increased risk of bleeding. NSAIDs have the property to thin your blood more, right? So if you already are taking a blood thinner, now you're taking Advil, Aleve, Motrin, it can increase your risk of bleeding. So we usually say avoid that. So now the question becomes, what if I only take Advil like once a month? Then it's not really a big deal, right? I'm talking about consistent. There are patients out there that they take Advil, Aleve, Motrin every day. Some of you might know some of these people. Some of you might do this yourself, right? So unless the doctor says it's okay to do that, right, or he or her self-prescribes you, do not routinely, regularly take those medicines over the counter. But again, once a month, every other month, if you needed it for a headache or some kind of back pain or something like that, it's okay, but do not make a habit out of it. There's other reasons why NSAIDs are, not safe to take consistently. Their reasons are if you have kidney disease, NSAIDs, taking them every day can worsen your kidneys. They can increase your risk of heart disease, including increasing your blood pressure, and they can also lead to stomach problems. So if anyone has stomach ulcers, right, if you have ulcer disease, peptic ulcer disease, heartburn, things like that, NSAIDs actually make that worse. So if you actually pick up a bottle of Aleve, all of this is written on the back, right? But in such a small letters and, it's so much other information that it becomes very diluted. But just keep in mind, whenever the point I'm making here is you buy stuff over the counter, read the labels, talk to your doctor, talk to the pharmacist. The next, row here is blood pressure lowering agents, right? Blood pressure are amongst one of the most commonly prescribed medicines. A lot of people take blood pressure medicines even when they're younger, middle age, older age. So blood pressure medicines interact with certain medications over the counter as well. So what are some examples? Examples are decongestants. So, over the counter, right? Or if you have a cold or a flu, you can go over there, you can see Robitussin, cold and flu, Mucinex, cold and flu, Sudafed, right? Claritin D, all these drugs, right? What's inside? Decongestants are inside there. And what do decongestants do? They close down on your vessels and they increase your blood pressure. So that's why we in general recommend decongestion should be avoided. That's why you might see on that commercial on TV, if you have high blood pressure, take Coricidin HBP. Did anybody ever see that commercial? Yeah, there's a drug out there called Coricidin HBP. So that's specially formulated for cold and flu symptoms for people with high blood pressure. The HBP stands for high blood pressure. So that's safe to take. But again, any decongestion, again, if you're not sure, read the little bottle that you're going to be buying or the package or whatever it is, or ask the pharmacist, because sometimes even like NyQuil has decongestion inside, right? It doesn't say decongestion anywhere, but if you flip to the back, in little letters it will say that. So try to avoid decongestion if you have high blood pressure issues or if you're taking medicine for high blood pressure. There's a few other reasons as well you should avoid it. You see on the row here, not only do decongestants increase blood pressure, they can also worsen glaucoma, right? So glaucoma is an issue with your eyes where there's too much pressure behind your eyes, and also in men, prostate issues, right? If you have prostate issues, decongestions can actually make those issues worse and cause more trouble going to the bathroom. So just some things to keep in mind. Next row here we have sedating medication. These are also pretty common, medications that are prescribed. I'll give you some examples. Xanax, Klonopin, Trazodone, right? These are some medicines, Seroquel, Quetiapine. Now these are medicines your doctor might prescribe for either anxiety or to help you with sleep or for other mood conditions. These medicines sedate you, right? So when these medicines sedate you, you should avoid certain over-the-counter medicines that also cause sedation. So one example is antihistamines, right? So what are antihistamines? Antihistamines are, again, cold and flu type of drugs. I'll give you examples and you'll know right about what I'm talking about. Benadryl is an antihistamine. Claritin, antihistamine. Zyrtec, antihistamine. So these are antihistamines that are listed on here. They're very commonly available in cold and flu products as well. If you're taking other medicines that sedate you, try not to take those medicines over the counter for a long period of time, because that can lead to what? Excessive sedation, right? And again, one of the biggest issues we see with combining these medicines that people have the risk of falling down, right? They also, again, cause prostate issues for men as well. So in general, you should be avoiding antihistamines for a long period of time if you're taking sedative medications already. Next drug we have here on this list, which we don't see as much use anymore, but there are still a few patients on it, Coumadin, warfarin. Right? Have you heard of that drug before? Coumadin, warfarin, right? This is one of the first blood thinners that was ever made. It's been around for decades, and it's a great drug, but actually it's also kind of a nuisance as well. So if you've been on this drug, or if you know somebody that's been on this drug, you'll know what I'm talking about. If you're taking warfarin, you should avoid inconsistent vitamin K intake. Again, if you're not taking warfarin, this does not apply to you. You do not have to worry about this. Other blood thinners do not have this exception. It's only Coumadin, only warfarin, the blood thinner, not the other blood thinner. You should avoid vitamin K, excessive vitamin K intake. So you might have heard from a loved one or even yourself, if you were ever on this drug, if you're on warfarin, they tell you not to eat green vegetables. So green vegetables have vitamin K inside. And what happens is if you have too much vitamin K, it makes the Coumadin work less. So what happens is if you've been on Coumadin, you have to get blood tests done routinely to make sure it's working appropriately in your body. And you need to be in between a certain number. And a lot of patients don't end up in that certain number because their medications are interacting with it, or they're having too much green vegetables. So again, if it doesn't apply to you, you don't have to worry about this. If you need more information on that, please reach out to me if you're on that drug. But green vegetables and warfarin do not mix well. So the thing is, I'm not sure if anybody's here. I don't like to ask personal questions in an audience like this. But the thing with warfarin is, people say, what if I like to eat green vegetables, right? Don't we recommend people should be eating green vegetables? They're healthy, right? If you're on Coumadin and if you like your green vegetables, the only thing that you really have to do at that point is eat the same amount of green vegetables every single week, consistent. So if you have broccoli 3 times a week, you need to have broccoli 3 times a week every week, right? Now, broccoli versus spinach versus okra versus lettuce, they all have different amounts of vitamin K inside. So 1 cup of broccoli is not 1 cup of spinach. And the reason why I say that is, let's say you want warfarin, you go to your doctor's office, they check your blood, and your number is perfect, right? Your INR is great. Your doctor says, all right, keep doing what you're doing, that's good. And that week you had no spinach. Now, next time you go to your doctor's office, you had spinach the day before. You go in, doctor says, wait, the Coumadin level is, the INR is low, the drug isn't working. Did you not take the medicine for a few days? And you're like, no, I took the medicine regularly. And then the doctor might ask you, well, did you have green vegetables this week? And then see, that's something you didn't do in the last visit, but you did do in this visit, and that'll affect the way the Coumadin works. But if you're having the consistent amount every week, then it won't affect it like that, because your doctor will already be monitoring, and they will adjust your dose based on how much vitamin K you're having. Again, a lot of patients aren't on this drug anymore, so it doesn't really matter, but for people who are on the drug, it's very important to have that concept in mind. And then the last row here is the one we started off early on. We talked about herbal supplements, right? Keep in mind, vitamins and herbs are not the same thing, right? So vitamin A, B, C, D, multivitamins are not herbs. When I say herbs, I'm talking about St. John's wort, valerian, right? Ginkgo, even things like ginger, garlic, turmeric. These are herbal supplements and spices that you can actually now find in powder and tablet form. So if you are taking any of these, right, do not start them until, or do not even buy them until you speak to either your doctor or your pharmacist. So I'll give you an example. Two very popular herbs. One is St. John's wort. Has anybody heard of St. John's wort?
Yes.
Right, so St. John's wort and valerian, they interact with more than 50% of medications out there. So again, do not take those medicines, because what those drugs do, they make your other drugs work less. So again, what if you don't take any prescription medicine? Then it's fine, but I always recommend, if you're going to buy those two products in particular, because they're notorious for causing interactions, always check with your pharmacist or your doctor, have them look at your prescription medicines. If they don't interact, you can take them, but do not just blindly take them over the counter. I mean, some people say it really helps them with their mood, depression, things like that, but you really shouldn't be taking it if you're on prescription medicines. So the last topic I want to go into now, which is again a huge thing that I see in the hospital, is issues with medication cost. Right? Medication cost is a big problem, especially in America, right? Because they charge you an arm and a leg for some of these medications, right? And if I feel very bad when I have so many patients that come to the hospital because they can't afford the medicines that they're taking, right? And now I'm talking about especially the patients who have Medicare, because when you have Medicare, right, I'm assuming most people in this room have Medicare, right? Medicare is an insurance company where there's a lot of caveats, a lot of co-pays that become high due to certain reasons, which I want to explain today. So cost of medication is a huge thing. I always tell patients, if you go to the pharmacy and you find that a medication is too expensive, right, please do not just say, oh, I'm not going to take it, and then just move on with your life. Please let your doctor know right away, right then and there. Because a lot of times the reality is when doctors are seeing, hundreds of patients, right? Doctors are doing so many things. When they send a prescription to your pharmacy, they don't have the time to call the pharmacy and say, hey, we sent drug for Mrs. Smith, was it covered by the insurance? They don't have the time to do that. We're relying on the pharmacy to call us. But again, now the pharmacy is filling 1,000 prescriptions. Do you think they're calling every single doctor with these issues? The reality is they're not. So if you go to the pharmacy and the medication is too expensive, please call your doctor's office right away and let them know that. Why do I say that? Because a lot of expensive medicines, right, are good drugs. They also have lower cost medicines that are just as good, right? Or even if they're not just as good, they're at least similar to some extent. There's always an alternative to medicines. So when you go to the pharmacy and you assume it's $500, I don't want to pick it up, you're actually doing yourself injustice, because they can put you on a drug that's $5 that does pretty much the same thing, right? So always let your doctor know with medication cost if it's an issue. So these are some definitions I want to tell you about. My dad turned 65 recently, so I did Medicare for him. I enrolled in a plan for him. And, I sat down on the computer and did all this for him. Again, he wouldn't have been able to figure this out on his own. I'm a pharmacist, so I had the background. I knew what he was getting himself into with Medicare, so I actually picked a plan for him. So when it comes to Medicare plans, right, there's Medicare Part A and B, right? Medicare A, that's the red, white, and blue card that you get from the state. That's your Medicare card. That's for hospitals and doctor visits, right? Then there's Medicare Part D. Medicare Part D, D for drug, right, is optional. When you get Medicare Part A and B, you do not automatically get Part D. I just saw a patient yesterday. We put him on like $5,000 worth of drugs, only to realize that he never got the Part D plan. So when you don't have a Part D plan, right, your drugs are not going to be covered at all. So that's why I tell patients, if you're on medicines and you have Medicare, always tell Medicare that you need Part D for drugs, and they'll cover your drug costs. But now there's 1,000 of Medicare Part D plans, right? So there's certain definitions I want you to be aware of. There's something called a premium. Does anybody know what a premium is when it comes to Medicare? Right? It's a fixed amount that you're paying every single month. Right? So I'll give you an example. I always like to tell patients this nowadays because now I went through this with my dad. So when my dad was looking for a plan, when he went on a website, there was a plan for $17 a month, the premium $17. There was a $50 one, and there was a $100 one. Which one do you think my dad was picking?
17.
Of course, right? You want to go with the cheapest plan, right? Not realizing he takes 7 medications, right? So naturally, right? You would want to pick the cheapest plan. But he didn't realize that when you go in that website and you plug in the drugs that you're taking, it tells you you will pay $17 a month for your premium, but when you go to the pharmacy, you're going to pay $80 for each pill that you're going to be getting. So 80 times 7, couple of $100, right? So even though he's paying less per month, his copays are way higher. So that's why I tell people, do not make that mistake. How do you go around it? Again, if you're not computer savvy or you don't have one available, you can call the Medicare agent. They can do this for you over the phone, right? So you call Medicare, you tell them, I take Eliquis, I take metoprolol, I take amlodipine, I take Brilinta, and then they'll plug your drugs into their computer, and they'll say, okay, Mrs. Smith, based upon your drugs, you should pick the $50 plan. The reason why we say that is because if you pay $50 a month, your copays will now be $10 a month when you go to the pharmacy. So again, you're paying more per month, but at the end of the year, you're paying a significantly less amount. So that's what a premium is. Do not get fooled by just picking the cheapest one. But again, if you're lucky enough to not be on any medicines, right, or you're lucky enough to be on just 2-3 medicines that aren't that expensive, maybe the $17 plan is the right one for you, right? So there is a case for it, but don't automatically go for that plan until you plug in the drugs that you're on. The next very important concept is deductible, right? You've probably heard of this term, right? Deductible. It's a huge, huge, huge problem, and there's a misconception with it. So I'll give you an example. So deductible is a fixed amount of payment that you have to pay out at the beginning of every year, every single year, before your prescription drugs become lower. All right, so what happens is that the deductible for 2024, it's about $450, all right? So what happens in January, my patients come to CVS, right, and they co-pay $450 for medication that they just paid $10 a month for in December. So they're like, I'm not picking up the drug, I'm not paying that, I just paid $10. It's a huge misconception. That's a deductible. Unfortunately, you have to pay that. You have to. So, but keep in mind that $450, that's only for January. Once you pay that deductible, next month it'll go back down to what it was in December. But you have to meet your deductible, right? What do most patients say? This drug, $450 a month, I'm not paying for it, right? And I understand that completely. It's a lot of money, right? But if you don't meet that deductible, your copays will never go down. Right? And it's not every single month. The deductible is just a one-time thing. It's in the beginning of the year. Sometimes what they do is each drug will be $150 for 3 drugs. So when you 150 times 3 is 450, then the drug cost goes down. So keep in mind in January, if you see those higher copays, I'm sure some of you might have experienced this. If that's because your deductible, you have to meet it. Now let me go back to the point of the premium. When I picked a premium plan for my dad, I picked the one with no deductible. So then you don't have to pay that $450 in January, but of course you're paying a higher premium, but it makes it better for you. Why? Because they're breaking down that $450 into monthly payments. So again, sometimes you don't have a few $100 that's just shouted at the beginning of the year, So keep that in mind. You could pick a plan with no deductible. It's a little more expensive, but you end up saving. And again, if you are going to be picking a plan with deductible, please just make sure you have savings for the beginning of the year so you can pay out that deductible. I always tell my patients that. The next definition is, you might have heard, Medicare gap or donut hole. Has anybody heard that? Donut hole, Medicare gap, right? So the donut hole is another big issue with Medicare. So what happens now, and that's why I say it's so hard for people who have Medicare. So you're at the beginning of the year, you're in January, you pay your deductible, right? And now your copays are back down to $10 a month. At a certain point in the year, not every patient hits this. If you're taking a lot of expensive medicines, like I'm talking about thousands of dollars worth of medicines, you're going to hit the donut hole at some point during the year. Sometimes it's June, sometimes it's August, sometimes it's December, depending on how many drugs you take, so it's very individual. Some people never hit the donut hole. So the donut hole is, after your insurance has paid a certain amount of money for your drugs for you, you hit the donut hole, and now you have to pay $200-300 every single month until the end of the year. So if you are taking a lot of medicines that are expensive, you have to talk to your insurance. Sometimes there's ways around that, but you have to talk to your insurance. For most patients, not most, but a lot of patients do not hit the donut hole ever, because their medicines aren't that expensive. But again, you might know if you take 10 medicines, you're most likely going to hit the donut hole at some point in time during the year. And the last definition is co-insurance. Co-insurance is basically a fixed amount of money you have to pay for every single service. Again, that depends for medical visits, for prescriptions. That's just a definition I put out there for your reference. So when you go to the pharmacy and your copay is $10, your co-insurance is a part of that. That means if a drug is $100, you're paying 10% co-insurance, you're going to be paying $10 for the $100 drug. But what if that drug was $2,000? 10% of $2,000 is $200. So your drug costs change based upon what your co-insurance is. Now there is a solution to some of these issues, and that's why I put the last slide on there. It says prescription insurance. There's a few numbers. Has anybody heard of something called EPIC?
Yes.
Okay, so EPIC, a lot of people do not know about this. A lot of my patients do not know about this. EPIC is actually a plan for patients with Medicare where they help reduce your prescription drug cost. So if you meet these criteria, if you have Medicare Part D, if you are a resident, obviously, of New York State, which I'm sure most of you are, age 65 or above, but then there's income limits. If your income is per year less than $75,000, and again, Social Security, it will be less than that, or $100,000 if you're married, you are eligible for EPIC. What you have to do, you have to fill out a form. I left their phone number there as well, and there's a website. If you go on that website or you call them, if your drug cost is a big issue, call EPIC, you might be eligible. I think it's, for some people it's free, depends on how much money you get, every month. Sometimes it's free, sometimes only like $10 a month. So when you pay for EPIC, what it does is it takes care of your deductible and it takes care of your donut hole to some extent. So EPIC is a source. There's a new program out called SHIP, State Health Insurance Assistance Program. I put the phone number here too. Again, this is for the patients if you have issues affording medicines, if your medicines end up being very expensive, please reach out to these two numbers and go on their website, sign up for them. You'll save a lot of money. You'll save hundreds of dollars per year. So make sure if you are having the issues with your medicines, you do that. And I would advise, if you already have a Medicare plan right now and you notice you're paying a lot per month, or for your prescription medicines, when 2025 is coming around, October, November is the enrollment period when you're renewing your insurance, pick a different plan. Pick a different premium. You can keep the same insurance, but call insurance and say, hey, listen, I'm paying too much for my copays. Can you give me a better plan? And they'll say, all right, we'll increase your level to $20 more per month, and we'll give you a better plan. That way you're not paying an arm and a leg every time you go into the pharmacy. So very, very important. These resources are out there. And that pretty much concludes my presentation, and I'll take any questions that you have.